Hey everybody, today I'm going to be talking about rheumatoid arthritis for my topic. My name is Diana Harrelson, and yeah, let's get into these slides. So like I said, my name is Diana Harrelson. My major is human resource management. I do have a long family history of this disease, and that is one reason why I chose this topic. Something that I didn't know before is that women are 3 times more likely than men to develop RA. And RA is a chronic inflammatory disease that affects the joints, and that is something that I think everybody should know. So a little bit about the background and why I chose this, the background history in my family. Back in the 80s, my great-grandmother Marjorie Wilson was actually a test subject at the Cleveland Clinic for treatments. Marjorie Wilson actually passed away from the illness in 1985 at the age of 65. Somebody else in my family that had rheumatoid arthritis was John Brush, my third great grandfather, who's actually primarily remembered as a principal owner of the New York Giants in Major League Baseball. He tragically passed away from complications from RA as well. And then leading up to my current grandmother, Wendy Wilson, who's currently struggling with RA right now. So history of RA. RA was first recognized in modern medicine in 1800s by a French physician, Dr. Augustin. His treatments for RA, although not effective, were rest, ice, compressions, elevations, the apple diet, nutmeg, some light exercise, fasting, honey, vitamins, insulin, magnets. So those were a few of the historic treatments for RA that were not effective, but that is what they used to do back then. So let's talk about RA. What is RA? So RA, rheumatoid arthritis, is a chronic inflammatory disorder that can affect more than just your joints. In some people, the condition can damage your lungs, heart, and blood vessels. It occurs when your immune system mistakenly attacks your own body's tissues. So there's some pictures of what RA is and kind of what it does. So RA affects between 0.5 and 1% of adults in the developing world, with between 5 and 50 per 100,000 people newly developing the condition each year. Onset is uncommon under the age of 15, but the disease most commonly starts in women between 40 and 50 years of age. For men, it usually starts later. So my great-grandmother, she actually was showing signs of RA when she was 12, which was crazy. So signs and symptoms of RA typically manifest with signs of inflammation, with the affected joints being swollen, warm, painful, and stiff. Normally in the morning, especially like if you're doing light exercises and you notice that your joints and stuff are getting stiff. The inflammatory activity leads to tendon tethering and erosion, and destruction of the joint surface, which impairs range of motion and leads to deformity. So what is the treatment for RA? The goal of treatment are to reduce pain, decrease inflammation, and improve a person's overall function. This may be helped by balancing rest and exercise, the use of splints and braces, or the use of assistance devices. Pain medications, steroids, and different kind of medications are frequently used to help with symptoms. Certain medications can also be used to slow down the progression of RA. So there's nothing that's going to be able to actually stop it, but there are things for it to help slow the progression of it. So here are my references for who I have used for like research on RA. Definitely check them out so you can get some more information.